Okay, so when we left off, I think we were talking about finishing up on FIP. If I remember right, we were talking about the diagnosis. I believe that's where I left off. So picking up on FIP, and the number one test you're probably going to do is the abdominocentesis. And your analysis may show proteinuria, bilirubinuria, because the effect FIP has on the kidneys and the liver. And then looking for organomegaly, just looking for enlarged organs from the inflammation. And sometimes if we do serum chemistry, liver enzymes are elevated. Azotemia is elevated BUN. So if the BUN, which is blood urea nitrogen, is elevated, that's an indicator that the kidneys are being affected. You can do an ELISA test, and remember, FIP is caused by a coronavirus. So you're looking actually for coronavirus. You can do PCR testing in body fluid or from a sample of tissue. Most of the time, if you're submitting for testing, you're either submitting blood or you're submitting the abdominal fluid that you collected during the abdominocentesis. So you can do that on either. But the prognosis, unfortunately, is grave. Can be a few weeks, a few months, depending on how involved the liver and kidneys are. Obviously, the greater degree of damage to the liver and kidneys is going to increase mortality. So unfortunately, treatment is not successful. We really have to do supportive care. And supportive care, number one, this first blank right here would be abdominocentesis. I think Cassidy said yesterday in the chat that their clinic, usually when their abdomen is so large with fluid, you will pull all that fluid off to relieve pressure on their diaphragm, relieve pressure on the abdomen. And again, you can do that several times. Sometimes animals will come in for multiple abdominocentesis. It usually doesn't fill up in a day or two. It may take a month or two. It depends on the course of illness. But an abdominocentesis is just a supportive measure to relieve pressure from the abdomen. The other thing, the second blank here would be steroids. So steroids offer some inflammation support. So they're, anti-inflammatory. And then the third one would be antibiotics, because again, anytime the body is fighting a virus, you support the body by giving antibiotics to hopefully prevent secondary infections. So really it's just supportive care, making sure that they're eating, making sure they're hydrated, making sure they can breathe, and that's what the supportive care does. Now, in FIP, there is a modified live injection. There's 2 doses. That should be, and that's IN, intranasal. So we're not giving this IM, it's an intranasal, because again, coronavirus likes to attack nasal respiratory epithelia. So you give the vaccine that way, it's going to be more beneficial. But a 0.5 ml intranasal, 3 to 4 weeks apart, as long as they're at least 16 years of age. Now again, this isn't a routine. FIP is fairly uncommon and it's not a routine illness, but if you have a male cat wanderer, outdoors, history of fighting, high stray population, and your cat is outside with the strays, it may be a vaccine to consider. It's not typically a core vaccine. So, you can disinfect. It is fairly rare. So really, if it's an indoor cat, it's usually not a recommended. And even if they're kind of outside minimally, it may not be recommended. I can't take that now. We're gonna have to wait. But you're gonna actually be able to hold on 1 second. Okay, I can't reach it. You're gonna have to wait till I'm done. all under the couch. I apologize. Okay, so let's talk now. Do you have any questions about FIP? FIV, which is known as feline immunodeficiency virus, it is a retrovirus, and sometimes people call it feline AIDS because it is similar to the AIDS virus in people. And you cannot catch this from cats. People cannot get AIDS from cats. And so sometimes I think clients are better now, but when AIDS was prevalent and feline AIDS, and then people are like, oh my gosh, you're going to collect, contract it from your cats. It's not to that degree. So, so when we talk about FIV and it being a retrovirus, virus replication is going to take place in the white blood cells. So it does affect the white blood cells that specifically, primarily the lymphocytes. And the lymphocytes are really what protect us against viruses. And there was another note I wanted to make about that, and I'm trying to find it here. And so when the immune system is affected, because it attacks the lymphocytes. Now, if you remember with lymphocytes, there's B cells and T cells. And B cells are more prevalent, but when it affects the T cells, the other body systems are affected because the animal is immunosuppressed. So the problem is when an animal is immunosuppressed, and especially this immunodeficiency virus, they are susceptible to a lot of other conditions because their body cannot fight off basic infections that a normal animal, and so you would get this secondary infection. This first blank here should say male intact outdoor cats are at the highest risk. So if they're outdoor, also if they're male intact, because male intact cats fight. And not that females can't fight, but male intact cats outdoors are more likely to get into fights. And this is going to be spread through these fights. So of 1.5 to 3% infection rate, 9 to 15% cats showing, illness. So again, it's there. It's not a very, 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 very common virus. And bite wounds are the common route of transmission. So it doesn't seem to be spread by breeding. So this blank right here should say bite wounds. And that's why if they're fighting, they're going to be at a greater risk to get this illness. Now, doesn't seem to have a sexual transmission, so during breeding, but more of the fights. Now, kittens can come get infected if the queen has it. So if the queen gets exposed, it can be spread with the direct contact. If we're going to do SNAP testing for this, it's usually not until they're 6 months of age. If you get a positive and they are younger than 6 months, they usually say to repeat it. When they're closer to 8 and 12 months. So either wait until they're 6 months old, it's going to be more predictive, more accurate. So what do we see when they do have this illness? So the clinical signs we tend to see is chronic unresponsive infections. They can't fight things off. So stomatitis is infection of the oral cavity or inflammation of the gums, the tongue, the cheeks, the lips, skin and ear infections, upper respiratory infections. It can actually cause anemia because it suppresses the bone marrow. So even though it's attacking the white blood cells, if it affects the bone marrow, they can be overall anemic. We talk about cachexia, well, let me go, diarrhea, because of bacterial infections. Cachexia is weight loss, and anorexia is not eating. So they can be cachectic. Ocular disease, neurologic. due to potentially encephalitis from infections. Um, Talked about, um, and for the ocular disease, that's talking about it inflames the nerve and potentially have inappropriate ocular responses. The other two blanks here would be pale mucous membranes, because if they're anemic enough, they can actually look pale. And the second blank right here would be chronic fever. So because they're infected and they're fighting off illnesses, they can actually start to become febrile because the body is trying to post an immune response. So the thing is, they can be carriers of this and remain asymptomatic. It can be a low viral load, not enough to cause a problem, but what an owner might start to notice is, wow, I can't clear up this ear infection. They keep getting upper respiratory infections. And eventually, after that's being treated for these other infections, you kind of go, why is your cat not getting better? It doesn't seem to be improving. So these chronic infections that are not improving eventually can catch up with them. As far as diagnosis, pretty much the clinical history, especially if they're outdoor, especially if they've gotten into fights, a positive ELISA test. So you can do, but you can get false positives. So the Western blot can be done in the lab to confirm the diagnosis. And then obviously if you do CBC, they're going to potentially have anemia and lymphopenia, which again, it primarily affects, all white blood cells can be low, but it primarily affects the lymphocytes. So especially if there's a lymphopenia, it can be more apparent. As far as treatment, it's kind of the same. You have supportive care, because if they have a bad upper respiratory, you got to treat the upper respiratory. If they have a bad stomatitis, you got to treat the stomatitis. The skin infection, maybe you're doing baths and antibiotics. Now, one thing that you can do, if you have a cat that has very bad stomatitis, gingivitis, there have been people that have pulled their teeth. Pulling their teeth, and that sometimes can make the gums or the stomatitis improve, and then the cat would have to obviously be on a pretty much canned / liquidy diet. So you can surgically remove teeth, extract teeth, if there is this reoccurrent unhealing stomatitis. It's kind of an aggressive procedure, but we will occasionally do full mouth extractions, pull all of the teeth, to kind of give the cat relief. Now, one thing, as far as another treatment, is you can isolate aggressive cats in the house. There is keep FIV positive cats indoors, or isolate in the house. So, I mean, I know that's kind of saying the same thing. Now, normally you would typically give them a normal diet as long as they're eating. You may have to change it if they have a lot of diarrhea. If their kidneys are affected, they may have to go on a low protein diet. They may need sometimes like a high calorie supplement if they're too cachectic. There are immunomodulator drugs that try to treat. In your, see, I have the older book, so I have to get you the page. My newer book is in here. But there are some, there's a drug called interferon. And interferon is an immunomodulator, and it's supposed to try and actually boost. It is, though, fairly expensive. So some of these immunomodulator drugs that try to boost the immune system, again, it's not killing the virus, it's just trying to support the immune system, do not always work. Unfortunately, prognosis, 20% within 2 years of diagnosis. So a lot of times these secondary infections just are too hard on the body, and that's what causes the death. And half of the cats remain asymptomatic during that period. So again, besides maybe getting little skin infections, little ear infections, a little vomiting, sometimes they're fairly asymptomatic for quite some time. It can be a year or less if they're in the severe if they're battling more than one infection, or they have severe muscle wasting, the prognosis is worse and death can be seen closer to a year. So if they have advanced disease or other organ involvement, multiple infections at the same time, that's a worse prognosis. For the FIV vaccine, though, they can test positive later if they've had the vaccine. That's why you can do the Western blot, because if you have a positive ELISA, you kind of need to know, has the cat had the vaccine? And the Western blot test can tell the difference between active infection and antibodies prior due to vaccine. So if you need to rule it out, you can do that testing. But again, this is another vaccine that's not routine. If your cat's indoors, if your cat's female, if your cat doesn't fight with other cats, if your cats in the household get along, then there's a low risk for this illness. So you kind of have to gauge what is the risk level for the cat and whether they actually want to get the vaccine. So, are there any questions about FIV? It's kind of, what I will say is definitely treating them very carefully at home, good nutrition, good husbandry. Try, sometimes if their cat has been outdoors, and clients will try to bring their cat indoors. Now, some cats will really have behavior problems if they go from being an outdoor cat to an indoor cat. But it's going to be better for the cat. And number two, we don't want them spreading the illness to other cats. And so they may have to isolate the cat. They may have to keep it in an area where it can't, pee on furniture. Because sometimes cats that you try to make indoors will inappropriately eliminate because they're mad. So it's something that the client would have to think about. But that is going to be definitely a recommendation. Kind of get them indoors, change their lifestyle, good supportive care, watch out for these secondary infections, get them on treatment fairly quickly if they do. Okay, so feline leukemia, and I kind of think about FELV and FIV kind of under the same umbrella, affecting the white blood cells, but I feel like feline leukemia is a little more prevalent than FIV. I feel like I've seen more FELUC cats than I have FIV cats or FIP. So of the three I just talked about, FELUC is a little more prevalent of a disease. I'm sorry, I'm trying to talk. So feline leukemia is a retrovirus. So it is a form of, this blank should be retrovirus. And it can cause death and disease. So this can also be fatal, especially it's going to be worse in multi-cat households. So if they have more than one cat, if they have cats that are in the house and go outdoors, they're going to be, it says it can be as high as 70% prevalent in outdoor cats. So it spreads very easy. It's very prevalent. So obviously the number one thing I'm thinking is keep your cat inside. So feline, it can affect 70% of all cats. Basically, you have a 70% prevalence. Male intact cats, again, are going to be more infected. So you have male and intact. Again, more contact with other cats is going to put them at a higher risk for infection. Now, as far as transmission, they do need close contact. So they do need to have kind of that nose-to-nose contact. It has been isolated saliva, urine, tears, and milk. So it's found in almost every secretion they have. It is also spread by mutual grooming. This blank should be grooming. Sneezing. This blank would be coughing. Or exposure to infected secretions like milk, tears, things like that. So if they are, tears, milk, but they are shed in high quantity in saliva and tears, primarily saliva and tear secretions. So sorry, hopefully I didn't get these blanks mixed up for you. There is transplacental and transmammary, so the mother can spread it to the kittens in the milk or through the placental blood. So it is going to be spread from the mother to the offspring. Now, if they're exposed, it depends on the cat's immune system. Are they, I'm sorry, this first blank should be age. So the cat's age. Their immunocompetence, meaning do they have an do they have a compromised immune system or do they have a normal immune system? If they're immunocompromised, they're going to be at a greater risk. So we look at age, immunocompetence, sex. So the sex, again, a male intact predisposition, the viral strain, dose, and this last blank is duration of exposure. So of course, the longer they're together, if a cat jumps up at your cat's at the screen and then they leave and there wasn't a lot of contact, there's a lower risk of exposure rather than they're spending a lot of time together, close contact, mutual grooming, contact with tears and things like that. So it does also have this transmitted by bite wounds. So obviously through bite. Now, the nice thing about the feline leukemia virus is, in a we're only talking about 24 to 48 hours. It has a very short, so 24 to 48 hours of life outside the cat's body. And when we say normal household conditions, normal temperature, normal humidity, things like that. Now, they say that they've grown it here. There's a note about zoonoses, that they've grown it in cell cultures, but there doesn't seem to be evidence that we can pick it up. Now, there is a note that if you have an immunosuppressed people, pregnant women, neonates, they recommend not being exposed to feline leukemia. It's not a high zoonotic potential unless there is some other concurrent infection. But if there is a pregnant woman in the house, or say you have a person in your house receiving chemo, or someone has AIDS, people on chemo are immunosuppressed, people with AIDS are immunosuppressed, people that are young babies can be, immune system needs to build up. So they do say kind of keep it out of the environment. As far as the stages, number one is you've got, if we talk about stages, you have the, initial viremia. So this would be a kind of a regressive viremia. So this is early stage. This is kind of when they're first exposed. They can actually post an immune response and fight this off and eliminate the virus on their own in the early stages. If we have what's called a progressive viremia, then it's moved on to the next stage. And this is where it does infect the bone marrow and does get into the tissues. So if it progresses, if they can fight it off in a regressive, that's early stage. If it's progressive, then it can be a persistent infection, and most likely they are carriers for the rest of their life, unfortunately. So sorry here. Let me get back to where I'm supposed to be. So again, a lot of times that's why I asked you that question on the test. What does it mean to be subclinical? Which everybody really got, which, you know, it's low grade, not enough to cause active infection. They will progressively start to deteriorate. It can be weeks, months, or years, depending on their viral load. So if we've got, right here, we've got persistent fever, this first blank. So this is going to be a fever that starts to progress and kind of can't seem to get rid of it. Not eating, anorexia, slow weight loss. Now, some animals can have severe wasting, and, you know, if they have a higher viral load. And when I talk about wasting, is clients will notice that their animal is eating, but they're not gaining weight. In fact, they're losing weight. So because the body is kind of starving them of nutrients, they get this wasting away. They can be anemic. They can get secondary infections and vomiting and diarrhea. They can also have this blank right here, renal disease. So occasionally it can, you know, cause renal disease, elevated BUN, some of these kidney symptoms, drinking a lot of water, dilute urine, if it progresses to this. And you can also get neurologic signs right here, like stumbling, stuporness, or in a stupor. So stumbling or stupor here. Now, the secondary infections, I had renal disease, spontaneous abortion, secondary infections, especially right here, upper respiratory infections. So this blank, upper respiratory, renal disease, neurologic signs, stumbling, and stupor. Now, you can also see tumors of lymphoid origin. And what that means is in the body, you have certain tissue, you know, the lymph nodes are your primary lymphatic tissue. So they can have swollen lymph nodes that actually, you know, so this can progress. The spleen holds on to a lot of white blood cells. The spleen can be enlarged or get tumors. So that's kind of what we think of when we think of lymphoid tissue, talking about like lymph nodes and the spleen. Now, as far as lesions that can be seen, this can progress to lymphosarcoma, which is also known as lymphoma. So some people call it lymphosarcoma, some people call it lymphoma. And lymphoma is the primary cancer of the lymph nodes, where their lymph nodes get enlarged. It can start, just as an FYI, it can be one large lymph node, and sometimes multiple lymph nodes are affected. So I've seen lymphoma both ways. One lymph node, it's more common that it affects multiple lymph nodes, but it can sometimes be seen in one lymph node. Or leukemia tumors. And again, we have to look at the spleen, and we have to put, you know, you can have chronic respiratory infections, chronic skin and ear infections. This can progress to, you know, what we talked about, upper respiratory, skin, ear, neurologic infections, encephalitis, and any chronic infection. sometimes a chronic infection is even a wound won't heal. Like maybe they cut their paw and, we've tried antibiotics and we've bandaged it and the infection still seems to persisting. So chronic ear and skin, urologic infections, and chronic infections. Normally what we're going to start with, obviously for diagnosis, is based, excuse me, we're going to do clinical signs. A CBC in this first blank right here on this page would be a non-regenerative anemia. So a lot of times, remember when you have anemia, there's regenerative, and you see signs that the body's trying to make more red blood cells. But because this affects the bone marrow and it can affect white blood cells, it can also cause anemia. But the non-regenerative form means we're not seeing any polychromasia, we're not seeing anisocytosis, we're seeing microcytic small cells, normochromic, no color change, and all of those are signs of non-regenerative anemia. So the ELISA test is detecting antibodies, and we're detecting, do they have antibodies? And we do have an in-clinic SNAP test. And that test, a lot of times feline, so probably most clinics always have feline leukemia SNAP tests and parvo SNAP tests and heartworm SNAP tests. Sometimes other tests are going to have to go to the lab. So you can do the immunofluorescent antibody test, and you're testing for antibody titers only. Antibody titers. So what is the level of antibodies that they have? Remember I said that detects, obviously the higher the titer, typically that's more antibodies, is more indicative of an active infection. If there's a low titer, it can detect older exposure. And that's kind of what we're talking about. So how do we prevent this? There is no cure. Prevent exposure to feline, feluke positive cats, and isolate the cats. So this one would be like isolation. So unfortunately, if a person wants to keep a cat that is feluke positive and they have other cats, they may need to just keep that cat, well, obviously test all the cats, but they may want to keep that cat isolated. And that's kind of, it says separate infected cats from uninfected cats. Keep up, consider vaccinating. Vaccines are not going to cause the illness. So I think some people believe that these vaccines are actually going to induce the illness. But, and again, feline leukemia vaccine is not probably, we don't usually recommend it for every cat. And in fact, I'll give you a little tip. Feline leukemia vaccine was one of the primary vaccines that was implicated when we started seeing feline injection site sarcomas. I was kind of to the point where I'm like, I don't think I want to vaccinate my cat against feluke. But there is a potential that, that was a possibility. And try to, adopt only infected free cats. Now, as far as management or keeping them, so it's kind of treatment and management, prevention all go together, but keeping them isolated, spay and neuter feline positive cats so they can't spread it to their litter and they can't spread it to the others. So you definitely want to try and get them spayed and neutered anyway. Now, wellness visits probably every year, even though a lot of people, they do their routine vaccines and sometimes they do the 3-year program, but you probably want to do wellness visits every year so we can keep them on this good diet, keep their environment stress-free. I was about to say stressful. No, you want to keep it stress-free. Antibiotics They may need appetite stimulants. I don't know if you guys have talked about mirtazapine. When my cat was just sick in July, mirtazapine is a common appetite stimulant. It used to be a little tablet, a tiny tablet. Cats sometimes would get a quarter tablet. I'd have to cut these little tabs into 4 pieces. It was a lot of fun. But when I just took my cat in that was sick, they now make mirtazapine for cats in a transdermal gel. I had to put a little finger cover on, and I would just put a little strip on the finger and rub it in his ear and massage it in his ear. And it actually helped him eat. Mirtazapine is great. And now it wasn't cheap. I want to say that little tube. It looked like an ophthalmic ointment tube. It was small, like eye ointment. I want to say it was close to $60. It was not cheap. So, but that's a new formulation. It used to only come as a tablet. Now there is transdermal mirtazapine. And then if this does, a lot of times feline leukemia, unfortunately, goes into potentially lymphoma, the client can consider chemotherapy as an option. Now, chemotherapy is not curative. What you're trying to do is slow it down. And, chemotherapy, you can sometimes get a year or more. It can be expensive. When I was in oncology, there was 3 chemo tiers. Like the top tier it's called a CHOP protocol, and it uses 3 different chemotherapy drugs in alternating rotation. And that was close to $4,800 to $6,000 for a full course of chemotherapy. There was like a mid-tier where we would only use 1 chemo drug. And then the lowest tier, which was the cheapest, was an oral medication that the owner could give at home. But obviously the most success is with the more expensive protocol. But there are chemotherapy options. There's different price levels. And I always tell clients, sometimes people are hesitant to do chemo in their pets, but they do a lot better than people do. Sometimes people know someone in their family that had chemo, and they were maybe sick and tired all the time. And, animals don't have the chemotherapy side effects like people do. So they do tolerate it fairly well. It's just, are you going to spend that kind of money? So not always is somebody going to be willing to do that. Okay. Are there any questions about those diseases? Okay. Now, one more thing. I went ahead, I don't know if you can see, this is your Moodle page. So this is the section we're on. We did that. I have to post yesterday and today's lecture, so I will do that. I did upload the rabies SOP project, and I put for this to be due not next Tuesday. Next Tuesday is week 7, a week from that. So Tuesday of week 8. Because I'm going to have to read them all and grade them. So I do, kind of need it. But that should give everybody plenty of time. Let me click on the rabies project and let me just explain what it is. Oh, shoot. Hang on. I got to make my screen small. Hang on. Let me pull it over here. Whoopsie. I'm glad I'm recording all this. Okay, so here's the handout. It's called an Rabies SOP project. Now, an SOP is a standard operating procedure. So it needs to be typed, and it needs to follow a format. And basically, what it needs to have is, how do you handle a rabies suspect case if it's alive and if it's already deceased? And that includes any animals that it's come in contact, quarantine, and what did we do, and then how do we handle human exposure? What do we do if somebody is exposed to an animal that's suspected of rabies? Let me tell you what happens in a clinic. If your dog goes outside and a bat flies in the yard and bites your dog. And then sometimes sometimes the bat is dead. I'm always kind of surprised that they can find the animal that bit their animal. But especially if it dies, we usually try to collect that specimen and send it to the disease lab for testing. And usually we quarantine the animal that has. Now, again, does an animal have a rabies vaccine or does it not have a rabies vaccine? Because if an animal gets bitten or if an animal bites someone, there is a different protocol if they have a rabies shot or if they don't have a rabies shot. And so what this protocol, now this doesn't have to be lengthy paragraphs, but I want you to think of it this way. If you went into a clinic and someone called you about their dog getting bit, if a staff member got bit by an animal, if their dog bit their neighbor, they're going to maybe call your clinic and say, what should I do? So normally the clinic has a binder or, has various SOPs, like what do we do with a lepto suspect? What do we do with a rabies suspect? What do we do for parvo? A clinic should have kind of SOPs, like, you don't bring them in the building. You put them in isolation. We do a test, So what I want you to do is write this from a perspective that if I was in a hospital, could I go to your paper and could it tell me what I'm supposed to do? Now, obviously you have your book, but there are also resources in your McKiernan. Now, I know that McKiernan, we've not really done any reading out of McKiernan, but there is also information in there. So does anybody have any questions? Okay, so, and I want to say in here, it says you also have to cite your sources. Now, I'm not talking about MLA format from like when you were in school and you wrote a paper, but it could be at the end, like McKiernan or University of Minnesota Vet School website or Merck manual, whatever. I would say at least 2 or 3 sources would be good, at least 2 sources. Thank you for asking that, Alyssa, but 2 or 3 sources. This is a skill. This is a skill for this class. So after I grade it, I'm going to have to go in your skill books and sign it off. So it has to be done. If I don't get it, because if you're like, oh, I have an A, you can, Bethany, if you want to put ClinMed 3 notes, but I would at least like at least one other main good source, like a veterinary school website or the Merck manual. If you find a book in the library, just at least the name of the book, the pages, or, I think I've seen some examples of these papers and people copied a link. So I could click on the link and I could look at the source. But think of it this way. There's no minimum page requirement. It doesn't have to be 4 pages. But the thing is, when you're in a clinic and things are crazy, you want this to be easily read. I've had people turn in assignments like this to me, 1 giant paragraph. Please don't do that. Because in a clinic, you want to see breaks. I want to see like vaccinated dog protocol, unvaccinated dog protocol. Kind of break it up so that, think about if you were in that scenario and you were trying to find information rapidly, could you do it? Could you use your source and could someone understand how to handle a rabies suspect? Or how to set up a quarantine? The easiest quarantine is when you have a healthy vaccinated animal, and we do our little 10-day, typically is like a 10-day quarantine. And as long as they don't show symptoms, they're usually fine. But you're always going to run into unvaccinated animals that didn't have a vaccine. And then what do we do? So hopefully, if you have any questions, email me. But this is posted, this handout is posted, and use it as your guide. I can also try to sometime this weekend upload the rubric. Okay, just leaving myself a note. So maybe that would be helpful. This is due next Tuesday, so not this coming Tuesday, but the following Tuesday. So you have this weekend, all of next week, next weekend, and Monday. Well, Rachel, I ended up not typing out the blanks separate because I didn't want it to be confusing, so I just decided to do it verbal. I could potentially do that unless someone can send you a screenshot of their blanks. I said I was going to upload it, and then I thought it could be confusing if people got the blanks mixed up, so then I didn't want that to happen. So I ended up not typing the blanks separately. Oh, sorry. Yeah, I guess if maybe one of your friends can send you a screenshot if they filled in the blanks, but if not, let me know and I can work on it. I can try to type it up. I have to go to a meeting in a little bit, but maybe I can. So type. If you can't get it from someone, let me know. Brooklyn, no, not this coming Tuesday. It's the Tuesday of week 8. So next week is week 7. The following Tuesday is week 8. Does that make sense? Sure. Is that the 20? I don't have my, hang on, let me pull up my little, oh, okay. Sorry, I can go back and put the date too. I just real quick was, yeah, the 27th. So it'll be due the 27th. Okay. So we know the due date. It's uploaded to Moodle. I'll get the other videos uploaded. And if you have other questions about it, let me know. Okay. But I will need it because I'll need time to get it graded before grades are due. All right. Well, you guys have a good weekend. And I will see you on Monday. We'll kind of go through the diseases, and Tuesday will be a quiz. And then we'll end with our last section, which is necropsy. All right. Thank you guys. I'll see you Monday. Have a good weekend. You too. Bye.